We're back again with Dr. John Vina, who's one of our leading cancer experts and is a cancer scholar here at the University of Georgia's College of Public Health. And in this segment, we're going to focus in on a couple of specific areas of cancer. And let's start with colon cancer.
Colorectal cancer here in Georgia is the leading cancer of number of new cases among men and women. The startling fact is that, similar to the United States, African American men and women have higher rates of both number of new cases and also higher mortality.
Wow, that's surprising. So is it tied to race or is it tied to something else?
Well, the lifestyle factors related to colon cancer are obesity, lack of physical activity, high-fat diet, and these are all higher risk factors in the African American community. But also, the higher mortality is related to, again, the prevention, early diagnosis, and prompt treatment. It's one of the most preventable cancers there is, but we have to have early testing, which is both the testing for blood in your stool, but then also getting a colonoscopy.
So it sounds like the public health message is get your colonoscopy after the age of 50, I guess, is the recommendation, and we can prevent some of the incidence of mortality.
Yes, and I have a personal story in that regard, in that my brother had a polyp detected in his late 40s. I was 48, and I went for a colonoscopy and also had a polyp detected and had it removed. And since then, I've been clear, and I go every 3 years. I kept telling my sister to go, and she delayed and she's 3 years older, and she delayed for 2 or 3 years. Then she had symptoms, and she went and she had to have part of her colon removed, and she had colon cancer. And thank goodness they caught it early enough so that she didn't have to have chemotherapy or any other treatment. But that's the, I guess that's a good story to say that if we catch it early, we can prevent the consequences of cancer.
And I want to ask about another type of cancer that is of particular concern to me, and I imagine most other women, and that is breast cancer. John, what can you tell us about the incidence and mortality of breast cancer here in Georgia?
Yes, the number of new cases of breast cancer in Georgia as the leading cancer among women is higher among white women after the age of 50 or postmenopausal breast cancer. However, under age 50, African American women have slightly higher rates of new cases. Unfortunately, the mortality information tells us that African American women have higher mortality for both pre- and postmenopausal breast cancer.
Well, it sounds like the public health message here, just like with colon cancer, is to have that early detection and screening for breast cancer.
Yes, prevention is the key. And getting a mammography is really important, and having access to the early screening programs is important.
Well, thank you for that really important information, John. We're now joined by Dr. Claire Robb, who is one of our 4 cancer scholars here in the University of Georgia's College of Public Health. And Claire's expertise is in the area of gerontology and epidemiology. And so my first question for you, Claire, is what do we need to know about cancer as it relates to older adults?
I believe that the American public is just now beginning to realize the dramatic impact that the aging population, those baby boomers that are reaching age 65, is going to have on cancer treatment and cancer survivorship.
Well, I know we have an aging population. I've learned that from you and from Dr. Poon in our last episode, but I don't necessarily understand what the implications are for cancer. So what do you mean by that?
A few years ago, there was a very excellent research study that came out from the MD Anderson Cancer Center in Texas, and they projected that in the next 20 years, cancer diagnosis will increase by 67% in those people age 65 and older. So in other words, the approximately 1 million cancer patients that we will see in the year 2010 by the year 2030, that will have increased to 1,700,000 older cancer patients.
Wow, that is amazing. That essentially means that we have a coming epidemic of cancer, if you will. And so what should we be doing as public health practitioners to get ready for this epidemic?
I think we need to gear up our cancer screening for one thing, and I think it needs to be directed more towards the older population. You know, there are a lot of older people that don't get screened regularly the way they should. Another really important issue is that older adults have always been underrepresented in clinical trials, the research that looks at new medications and treatments. And if we're going to successfully treat these older adults who do not handle medication the same way that younger people do, then we're going to have to try to really include them in our clinical trial research.
Well, thank you, Claire. You've really shown how two very diverse fields, such as gerontology and epidemiology as it relates to cancer research, can come together to address a very important topic, which is cancer prevention in older adults.
Well, as we wrap up today's episode, I have to mention, Phaedra, I used to work in cancer research, and frankly, it's depressing being around the death and suffering that's going to be involved with that. But after today's episode, I would have to say now I'm more encouraged as I realize the strides we've made in cancer prevention.
I agree, Cham. I mean, even if the numbers of cancer types and the incidence of cancer is increasing, I think we learned today that the percentage of mortality or death associated with cancer is declining, so that's great news. So what do you think is the reason for that?
Well, as we learned today's episodes, early diagnosis and the detection techniques that are being used now.
And I would also add to that improved access to those screening and treatment services.
And as access improves, and we can expect that to continue in the future, the new techniques, these new treatments are going to be available to more people.
Exactly. And we heard today from scientists who are on the cutting edge of finding better treatments for cancer, all the way to public health practitioners who are in the field trying to get people to have that early detection and screening.
So I am encouraged, and I hope that you who have watched the show today are as well, as the efforts by these cancer scholars and cancer researchers here at the University of Georgia have contributed to this improved cancer prevention.
And our next show is on influenza, or the flu, which is perfect timing because we just entered the flu season.
So join us for the next episode of Public Health Impact. Look for us in the TV guide and on the web.